Hi, my name is Kayla. I'm going to be your nurse today.
Hi.
Can you tell me your name and date of birth?
Emily Mitchell, 12/16/99.
Okay. So today we're going to be doing a complete head-to-toe assessment of you, of all your body systems, and just checking everything, make sure everything's doing good. Is that okay with you?
Yep.
Okay, so first I would assess her vital signs. I would check all her vitals, and I would measure height and weight. I would assess her pain scale, and then first I would do hand hygiene and provide for privacy. Okay. So first, we're going to be starting with your skin. So can I have your hands?
Yeah.
Okay. So I'm going to be checking your hands and checking for any lesions or abnormalities. Checking your nails for clubbing, which everything seems good. Checking your capillary refill, which is less than 3 seconds. That's good. So no lesions or scarring or anything or abnormal bruising. Your moisture's good, and color and pigmentation is even with your ethnic background and consistent. Your temperature's good, you're warm, and next your texture's good. No like presence of rough skin or anything like that. And I'm gonna check your turgor, and your skin returns immediately, which is good. Okay, so next I'm going to be assessing your head and your face, so can you just look straight at me for me? So upon inspection, there's nothing that sticks out that's abnormal, that's just out of the blue. Everything looks symmetrical, no lesions, bumps, or bruising. So first I'm going to be testing two of your cranial nerves. First I'm going to start with cranial nerve 5, which is your trigeminal nerve, and I'm going to use a cotton swab and touch different parts of your face with your eyes closed, and I want you to tell me whenever you feel each spot. So can you close your eyes for me? Okay. So just tell me whenever you feel it.
Okay. 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 Okay.
All right, good. So cranial nerve seems to be intact because you felt every spot that I touched you on. Next, I'm going to be testing your cranial nerve 7, which is your facial nerve. So can you smile for me? Can you blow your cheeks out? Can you frown? Move your eyebrows. Alright, so everything moves symmetrically. There's no lagging, there's no drooping of any parts of the face, so cranial nerve 7 seems to be intact. So next I'm going to be palpating your maxillary and your frontal sinuses. And when I palpate, you let me know if you feel any pressure or pain or tenderness. So start with your maxillary sinus. Any pain?
Mm-hmm.
And your frontal sinus. Any pain?
Mm-hmm.
Alright, so there's no signs of like sinus infections or sinusitis or anything like that. So moving on, I'm going to be palpating your lymph nodes, and I'm going to be checking for any enlargements or pain. So if you feel any pain throughout this palpation, you just let me know. So start with your submental, submandibular, preauricular, postauricular, occipital, then your jugular-digastric, superficial cervical, your deep cervical chain, and then your posterior cervical, and your supraclavicular. So there's no enlargements or anything that stuck out, so that's an indication of no signs of infections or anything like that, or no problems with the drainage of your lymph. So next, I'm going to be moving on to your eyes. So I'm going to just inspect your eyes. There's no like signs of protrusions or drainage or swelling or redness, so everything looks good. Alright, so first test that we're going to do is going to be testing your visual fields. So I'm going to have you take your right hand and put it over your right eye. I'm going to do the opposite, and I'm going to wiggle my finger, and you just let me know whenever you can see it.
No. No. No.
Okay, we're going to switch.
No. No. No.
Okay. And that tests your cranial nerve 2, which is your optic nerve, and you seen my finger at the same time I seen it, so everything seems good and symmetrical, no problems with that. So next, I'm going to be testing your 6 cardinal positions and just checking those. So I'm going to move my finger in different directions, and you just move your eyes. Keep your head straight and forward looking at me, so follow my finger. Okay. Alright, and that tests cranial nerves 3, which is your oculomotor, 4, which is your trochlear, and 6 is your abducens. So next I'm going to do your pupillary response, which is the accommodation. So I'm going to have you stare at my face, look directly at me, and then I want you to, when I say look at the wall, you look at the wall, and then focus back on me. So focus at me, look at the wall, focus back at me, look at the wall, and focus back at me. Okay, good. So your pupils constrict when you focus on something that's closer to you, and then they dilate whenever you focus in the distance. So that's good. So next, I'm going to test your corneal light reflex. So I'm going to have you look straight at me, and I'm going to flash this light, and I'm just checking to see if the light bounces off of you. Good. Okay. And then your pupillary right response. So I'm going to have you look at me, and then just check to see that your eyes constrict or dilate symmetrically. Okay, good. And then next, I'm going to be doing the test cranial nerves 2 and 3, which are your optic and your oculomotor. So next, I'm going to do the Rosenbaum test, which tests for near vision. So I'm going to have you hold this 14 inches out. And can you read the lowest line for me?
B, D, G, F, C, H.
Okay. So you read the lowest line, which is a 14 and a 14, which is normal. So next, I'm going to be checking your conjunctiva and your sclera. So I'm going to have you look up, and I'm going to pull your lower lids down and inspect your eyes. So look up for me. Okay, good. So your conjunctiva is pink and moist, and there's no dryness or drainage or any signs of lesions or anything, and your sclera is white and no lesions on that either. Alright, moving on. I'm going to be checking your ears. So with an otoscope, I'm going to be checking the outsides of your ears. I can see that you have a piercing on this side. Do you have any infections or pain with your piercing? Okay, so I'm going to start with palpation, and you let me know if you feel any tenderness upon palpation. Any pain or tenderness? Okay, so next I'm going to be inspecting the inner ear, and I'm going to be using my otoscope and checking the inside. Since she's an adult, I'm going to pull the pinna up and back. Checking the inside. Good. And I'm going to do the same thing to the other side. Pulling it up and back. Okay. So the tympanic membrane is gray and translucent. There's no signs of cerumen impaction, no bleeding or swelling or anything inside of it. Everything looks good. Lastly, I'm going to be testing your cranial nerve 8, which is your acoustic nerve, and I'm going to be doing this with the whisper test. So have you stand up for me, please? I'm going to have you put your finger in one of your ears and wiggle it around, and I'm going to whisper a set of numbers or letters, and I want you to repeat back to me what you hear. Just turn around for me. Okay, wiggle your finger. 1BC.
1BC.
Okay, switch ears. 1BC.
1BC.
Okay, good. Now you can have a seat for me. So everything was good. You heard every number or letter that I said, and you repeated it back correctly. So that cranial nerve is working well. I'm going to be checking your the patency of your nostrils first. So I'm going to occlude one side of your nose, and I want you to breathe in for me, and then we'll switch and do breathing out. So breathe in, breathe out. Okay, breathe in, breathe out. And you're breathing well, no signs of trouble breathing or obstructions or anything. So next I'm going to be inspecting, first I'd start by inspecting your nose, making sure there's no abnormals on the outside that I see. So then I'm going to check the inside of your nose and inspect your nasal mucosa, nasal septum, and your turbinates. So I'm going to have you look up for me. Alrighty. There's no signs of a septal deviation. Everything's pink and moist, and no signs of obstructions or anything inside your nose. And lastly, I'm going to be testing your Next, sorry. I'm going to be testing your sense of smell, which tests your cranial nerves 1, which is your olfactory nerve. So I'm going to have you close your eyes, and I'm going to place something under your nose, and you tell me what you smell. Okay. What do you smell?
Mint.
All right, moving on.